She is 27. आपकी उम्र क्या है? She is 26-year-old. She's a housewife. She presented to us with a lot of respiratory difficulty, fever, and you could see she is quite obese. If you look at her profile, she is very sedentary. She runs a shop next to her house. This is National Heart Institute. This is the isolation room of one of the ICUs in National Heart Institute. So when she came to us about 12th of this month, she was very breathless. Her oxygenation was not manageable. She was maintaining a very low oxygenation. She went up to as low as 70. So to show the first X-ray, if you look into the X-ray, the X-ray shows, a lot of infiltrations here. This is what we call bilateral pneumonias, which is basically taking the shape of the alveoli of the lungs. That means the lungs are filled with secretions or consolidation. Now what we did, this is the 12th. Sister then showed the next X-ray, and she was very bad. Her oxygenation was not maintained. Despite we were giving her good oxygenation, she was not able to maintain her oxygenation. And if you see her, there were a lot of congestions. These white areas, there's a consolidating both the sides of the lungs, and the black areas were small. And this is the time, this is showing around 13th March. This is around 9:26 in the morning. She was quite bad. She was very hypoxic, we call it. She was very breathless. And so we decided, and she was not manageable with oxygenation on. Then what we did is that we decided we have to ventilate her well, and this is a machine, what we call it, BiPAP AVAPs. These are non-invasive ventilations. Now, this is the decade of non-invasive ventilations, and normally what we have been seeing elsewhere is that people with those who have this kind of pneumonias. Let me tell you, before we get into this non-invasive ventilation, we thought probably this could be flu, swine flu, what we are talking about. So we sent those specific tests called H1N1. When did we send, sister? This is on 12th we sent, and 13th. So next morning we found it, she's H1N1 positive. And we had a clinical suspicion that she may be suffering from the swine flu, and this happened in March, practically when things were already coming to an end. So we diagnosed her as a swine flu pneumonia causing ARDS. ARDS means your oxygenation is low, the lungs are full of pneumonias, and this is called adult respiratory distress syndrome or something. It's very serious. And so we use this ventilation. This is called non-invasive ventilation. You see, we ventilated her with a full mask. For the last 3 days, she's on ventilation. We set up the desired settings on the ventilation, and these are non-invasive in the sense that they are very safe, and you can apply on the face and the nose, and you don't have to really go into the lungs and paralyze the patients. Normally what you must have heard or you have seen, or probably what normally doctors offer you, is that when the lungs become so weak, when you're not able to maintain oxygenation, we put them in a big machine. So since I believe that, if you have a good non-invasive ventilations, people sometimes, they feel that they cannot be managed. And I decided, no, I will take it as a challenge. She is very young. I will not put her into big ventilators because the results on big ventilators are very bad. Sometimes very difficult to take them out. So we retitrated the machines. There are two components in this machine, which call IPAP and EPAP. And we reset the machines. I've been maintaining this oxygenation 97% for the last 2 days, and that is really an achievement. And why it has been achieved, that is what it's really an eye-opener for the doctors and for the medical community. I didn't allow this mask to come off her face, because normally what happens when you are giving somebody a mask ventilations, whenever there's a food time or this thing, they get loosened up, and that is the time your oxygenation drops. So this is what I did. We made a side port for the oxygenation. There's a full face mask, and I have specifically instructed my team, don't remove the ventilation from the face. Let her be totally oxygenated, let her get a full ventilation advantage. But the most important thing was we had to give her the right nutrition. So we use this parental nutrition. This is a bag of nutritions we call CabiPen, which is a very high level of amino acids, and it can run through peripheral routes. We are giving through the neck veins. So this contains the lipids, the proteins, and all those things. And so we have been managing through a parental nutrition. And the best part of it, with a good ventilation and nutrition, her swine flu we have taken. She was in category C, which is very severe one. She was very young. And today today is the 16th, she's on this non-invasive ventilation from 13, you can say, the middle of 13. and I could see that she's out of the dome zones. And if you see the X-ray today, sister, if you show the X-ray, the X-ray showed a remarkable improvement. If you see
one
the
is 15 also.
huh? 15, but it's already the clearing has set in. The clearing has set in, and today also you have done it?
Today also I have done.
Yeah, this is the one. You see, practically the lungs have opened up here. So, in nutshell, swine flu, not to press the panic button, even if they come in ARDS, there's a worst which can happen to a swine flu. Always go to the root cause, give them, nourish them well, ventilate them well, but don't always take them to a large mechanical ventilation. Good non-invasive ventilations, through mask ventilations, with the right settings and nutritional support, you can really help them out. Thank you sisters for doing a wonderful job. And I think आप काफी ठीक हो रहे, कल परसों घर भेज देंगे.